Ever wondered about the signs of a hiatal hernia? Let's explore them together. A hiatal hernia happens when a part of your stomach pushes upward through the diaphragm and into your chest cavity. While some people experience no problems at all, for others, it can be a source of real discomfort and various health issues. In this video, we're going to delve into the top 10 hiatal hernia signs and symptoms you really should be aware of. By understanding these indicators, you'll be better equipped to recognize when it might be time to consult a healthcare professional. You might have an idea of what a hiatal hernia feels like, but you'd be surprised at how often its symptoms are mistaken for less serious conditions, such as everyday indigestion or simple heartburn. So, stick around as we uncover the sometimes unexpected ways a hiatal hernia can reveal itself. Let's get started. First up, heartburn. This is arguably the most common and recognizable symptom of a hiatal hernia. It's that familiar burning sensation that typically crops up behind your breastbone in what's known as the retrosternal region. The pain often travels upwards towards your throat, giving you the feeling of a fire spreading through your chest. This burning occurs because stomach acid escapes through a weakened lower esophageal sphincter and irritates the delicate lining of your esophagus. Your esophageal lining lacks the protective barrier found in your stomach, making it particularly vulnerable to acid damage, which results in that characteristic burning pain we call heartburn. The timing of heartburn linked to a hiatal hernia is a crucial clue. Symptoms usually intensify within 30 minutes to 2 hours after eating, especially following large meals or consumption of specific trigger foods. Things like spicy dishes, citrus fruits, tomatoes, chocolate, caffeine, and fatty meals are notorious for making the condition worse. Lying down or bending over frequently exacerbates the heartburn because gravity is no longer helping to keep stomach contents in their proper place. Many individuals notice their symptoms are more severe at night, especially when trying to sleep. This horizontal position allows stomach acid to flow more readily into the esophagus through the displaced portion of the stomach. The severity can vary from mild annoyance to intense pain that some patients mistakenly believe is a heart attack. Unlike cardiac pain, hiatal hernia related heartburn generally responds well to antacids and typically doesn't cause pain that radiates to the arms or jaw. However, if you're ever uncertain about chest pain, always seek immediate medical attention. Next, we have acid reflux. This occurs when the contents of your stomach flow backward into your esophagus due to a compromised lower esophageal sphincter. In those with a hiatal hernia, this sphincter often becomes less effective because the herniated part of the stomach alters the normal anatomy and pressure dynamics. The result is frequent episodes of acid backflow, leading to uncomfortable sensations. Patients commonly describe tasting something sour, bitter, or metallic in their mouth. This taste is, in fact, actual stomach acid and partially digested food that has traveled up the esophagus and reached the back of the throat. The hydrochloric acid from the stomach has a distinctly unpleasant flavor that many find quite nauseating. These reflux episodes often happen without warning and can occur during meals, shortly after eating, or even while you're asleep. Some individuals wake up with this unpleasant taste, indicating nocturnal reflux has taken place. Nighttime reflux can be particularly problematic because stomach acid stays in contact with the esophagus for longer periods. Certain activities can increase the likelihood of acid reflux for hiatal hernia patients. Bending forward, lifting heavy objects, or performing exercises that raise abdominal pressure can all trigger episodes. Even simple actions like tying your shoelaces or picking something up from the floor can cause acid to surge upwards. The frequency of acid reflux varies significantly among individuals. Some experience occasional episodes, while others contend with multiple occurrences daily. Chronic acid reflux can lead to serious complications, including inflammation of the esophagus, ulceration, and in severe cases, precancerous changes in the esophageal lining known as Barrett's esophagus. Let's talk about regurgitation. This is different from vomiting. It's the effortless return of swallowed food or liquid into the mouth without the forceful muscle contractions typically associated with vomiting. For people with a hiatal hernia, this happens because the displaced stomach anatomy disrupts the normal patterns of digestive flow. Food and liquid can more easily flow backward through the compromised lower esophageal sphincter. The material that's regurgitated usually tastes acidic and might contain recognizable food particles that were recently consumed. Unlike the bile stained vomit that originates deeper in the stomach or intestines, Regurgitation typically brings up contents from the upper stomach or lower esophagus. Patients often describe the material as having a sour taste mixed with the flavor of recently eaten food. Episodes of regurgitation can be unpredictable and, understandably, quite embarrassing for those experiencing them. The material might suddenly appear in the mouth while talking, laughing, or just going about normal daily activities. Some patients learn to anticipate these episodes based on certain triggers, such as specific foods, body positions, or activities. The amount of regurgitated material can range from small quantities that are easily swallowed back down to larger volumes that require spitting out. Frequent regurgitation can contribute to dental problems because repeated exposure to stomach acid erodes tooth enamel. Patients may also experience throat irritation and hoarseness from the continuous contact with acidic stomach contents. Next on our list is difficulty swallowing, or dysphagia. This medical term describes the sensation of food feeling stuck, which occurs in hiatal hernia patients when the displaced stomach anatomy interferes with the normal passage of food through the esophagus. The herniated part of the stomach can create a mechanical obstruction or apply pressure, making swallowing feel uncomfortable or incomplete. This symptom often develops gradually and may initially affect only certain types of food. Patients commonly describe a feeling like food is getting stuck somewhere in their chest or throat area. This sensation, known as globus sensation when it occurs without actual food being present, can cause anxiety around eating and drinking. The feeling of being stuck might last for several seconds to minutes and sometimes requires drinking liquids to help wash the food down into the stomach. The specific type of dysphagia can offer clues about the severity of the hiatal hernia. Initially, individuals might only struggle with solid foods, particularly dry or dense items like bread, meat, or pills. As the condition progresses, even soft foods and eventually liquids can become difficult to swallow. This progression suggests increasing anatomical disruption or emerging complications. Intermittent dysphagia is common in hiatal hernia patients, meaning the swallowing difficulty comes and goes unpredictably. Patients might eat normally for days or weeks, then suddenly experience episodes where swallowing becomes problematic. Stress, certain foods, or eating too quickly can trigger these episodes in some people. The psychological impact of dysphagia should not be underestimated. Many patients develop anxiety surrounding meals, leading to reduced food intake and potential nutritional deficiencies. Some start avoiding social dining situations out of embarrassment or fear of choking, which can significantly affect their quality of life and social interactions. Moving on to chest or upper abdominal pain. Chest pain associated with a hiatal hernia can be particularly worrying because it often closely resembles cardiac pain, causing patients to fear heart problems. This pain typically occurs in the substernal area, right behind the breastbone, and can sometimes radiate to the back, shoulders, or arms. This pattern of pain distribution happens because the esophagus and heart share similar nerve pathways, making it challenging to differentiate between the two sources of discomfort. The nature of hiatal hernia chest pain varies considerably among individuals. Some describe it as a burning sensation, while others experience sharp stabbing pains or a heavy pressure feeling. The pain might be constant or come in waves, and its intensity can range from mild discomfort to severe pain that interferes with daily activities. Upper abdominal pain, also referred to as epigastric pain, frequently accompanies a hiatal hernia. This discomfort is felt just below the rib cage in the upper central part of the abdomen. The pain stems from the displaced portion of the stomach being squeezed or trapped within the chest cavity, leading to pressure and inflammation in the affected tissues. Timing patterns help differentiate hiatal hernia pain from other conditions. The discomfort typically worsens after meals, especially large ones, or those containing trigger foods. Physical activities that increase abdominal pressure, such as bending, lifting, or straining, often exacerbate the pain. Many patients notice improvement when sitting upright or after taking antacids. Next, we have the feeling of getting full quickly, also known as early satiety. This refers to feeling full after consuming only small amounts of food, far less than what would normally satisfy your appetite. In individuals with a hiatal hernia, this occurs because the herniated stomach portion has reduced capacity and altered mechanics. The displaced part of the stomach cannot expand normally to accommodate food, which leads to premature signals of fullness being sent to the brain. This sensation is different from the normal fullness you feel after finishing a complete meal. Patients describe feeling uncomfortably stuffed after eating just a few bites or within minutes of starting a meal. This can be frustrating and concerning, particularly for those who previously had normal appetites and could easily finish regular sized portions. The anatomical explanation involves the herniated stomach portion being constricted by the opening in the diaphragm. This creates a smaller, effective stomach capacity and may interfere with normal gastric accommodation, the stomach's ability to relax and expand as food enters. Additionally, the altered anatomy can slow down gastric emptying, causing food to remain in the stomach for longer than usual. Early satiety can lead to unintended weight loss and nutritional deficiencies if patients consistently cannot consume enough calories and nutrients. Some individuals adapt by eating smaller, more frequent meals throughout the day, but others may still struggle to maintain proper nutrition despite these adjustments. The severity of this symptom can fluctuate, with some days being worse than others. Factors such as stress, specific foods, or the position of the herniated stomach portion can influence how quickly satiety develops. Some patients find that liquid calories are better tolerated than solid foods, leading them to rely more heavily on smoothies, soups, and nutritional supplements. Let's discuss bloating and belching. Bloating in hiatal hernia, patients arises from altered gastric anatomy that interferes with the normal movement of gas and digestion. The herniated portion of the stomach can trap air and gas, creating uncomfortable abdominal distension that patients describe as feeling like a balloon in their stomach. This trapped gas often cannot escape through normal belching mechanisms due to the anatomical disruption. The sensation of bloating typically develops during or shortly after meals and can linger for hours. Patients often describe their abdomen feeling tight, stretched, or uncomfortably full of air. The bloating can be visibly noticeable, causing the abdomen to appear distended and making clothing feel tighter around the waist. Excessive belching, or eructation in medical terms, occurs as the body tries to relieve this trapped gas pressure. However, for those with a hiatal hernia, belching may be less effective at providing relief because the displaced anatomy hinders efficient gas escape. Some patients find themselves belching repeatedly without any significant improvement in their discomfort. The accumulation of gas has multiple sources in hiatal hernia patients. Air swallowed during eating or drinking becomes more easily trapped in the displaced stomach portion. Furthermore, bacterial fermentation of food may increase because altered anatomy can slow gastric emptying, allowing more time for gas-producing processes to occur. Certain foods and beverages exacerbate bloating and belching in hiatal hernia patients. Carbonated drinks introduce additional gas that becomes trapped in the herniated stomach. Foods that naturally produce gas during digestion, such as beans, cruciferous vegetables, and high fiber foods, may cause more severe symptoms than in individuals with normal anatomy. Many patients learn to identify and avoid their specific trigger foods to minimize discomfort. Now, let's look at hoarseness or a sore throat. Chronic hoarseness and a persistent sore throat in hiatal hernia patients are often a result of stomach acid reaching the larynx and vocal cords due to acid reflux. The larynx houses the vocal cords, which are crucial for voice production, and these delicate tissues become inflamed and irritated when exposed to gastric acid. This condition, known as laryngopharyngeal reflux or silent reflux, often occurs without the typical heartburn symptoms. The hoarseness usually develops gradually and might be more noticeable in the morning after lying flat all night. Patients describe their voice as raspy, scratchy, or weak, and they may frequently need to clear their throat to speak clearly. Throat symptoms extend beyond just voice changes. Many patients experience a persistent sore throat, a feeling of something being stuck in the throat, or a constant need to clear throat secretions. The throat may feel dry, irritated, or inflamed, and some individuals develop a chronic cough as their body attempts to clear the irritating acid from the throat area. The timing of throat symptoms can offer diagnostic clues. Symptoms that are worse in the morning suggest nighttime acid reflux reaching the throat while lying down. Some patients notice worsening symptoms after meals or when consuming acidic foods and beverages that increase stomach acid production. Complications of chronic throat acid exposure include vocal cord inflammation, throat ulcerations, and an increased risk of respiratory infections. Some patients develop chronic sinusitis or postnasal drip symptoms because acid reflux can affect the entire upper respiratory tract. In severe cases, chronic acid exposure may increase the risk of throat cancer, making proper diagnosis and treatment essential. Nearing the end, let's talk about shortness of breath. Medically termed dyspnea, shortness of breath can occur in hiatal hernia patients through several mechanisms linked to the displaced stomach anatomy. Large hiatal hernias can physically compress lung tissue by occupying space in the chest cavity that normally belongs to the lungs. This compression reduces lung capacity and makes breathing feel labored or incomplete, especially during physical activity or when lying down. The difficulty breathing may manifest as feeling unable to take a deep breath or feeling like you can't get enough air. Patients often describe having to work harder to breathe or feeling like they aren't getting sufficient oxygen, even with normal blood oxygen levels. This sensation can be frightening and may lead to anxiety, which can further worsen breathing difficulties. Changes in position significantly affect breathing symptoms in hiatal hernia patients. Many individuals find that lying flat makes breathing more difficult because gravity allows more of the stomach to herniate into the chest cavity, increasing compression on the lungs. Sleeping with the upper body elevated or in a reclining chair often provides relief by reducing the amount of stomach tissue in the chest. Acid reflux related breathing problems represent another mechanism for dyspnea in these patients. When stomach acid reaches the throat and potentially enters the respiratory tract, it can cause bronchospasm, inflammation of the airways, and increased mucus production. This can trigger asthma like symptoms, including wheezing, coughing, and shortness of breath. The breathing difficulties may worsen after meals when the stomach is full and more likely to herniate into the chest cavity. Large meals or foods that increase bloating can exacerbate the compression effect on the lungs. Some patients learn to eat smaller, more frequent meals to minimize post meal breathing difficulties and maintain better respiratory comfort throughout the day. Finally, let's cover vomiting of blood or passing black stools, known as melena. Vomiting blood, medically called hematemesis, or passing black tarry stools, known as melena, represents serious complications of a hiatal hernia that demand immediate medical attention. These symptoms indicate bleeding in the upper digestive tract, typically originating from the esophagus or stomach. The bleeding occurs when chronic acid exposure leads to ulceration or erosion of the protective mucosal lining. Blood and vomit may appear bright red if the bleeding is active and significant, or it may look like dark coffee grounds if the blood has been partially digested by stomach acid. Even small amounts of blood and vomit should be taken seriously, as they may indicate ongoing tissue damage that could worsen without proper treatment. Black tarry stools develop when blood from the upper digestive tract is digested during its passage through the intestines. The iron in red blood cells turns black when exposed to stomach acid and digestive enzymes, creating the characteristic appearance of melena. This type of stool has a distinctive, unpleasant odor that differs from normal bowel movements. The bleeding typically results from complications of chronic acid reflux associated with a hiatal hernia. Prolonged exposure to stomach acid can cause esophagitis, esophageal ulcers, or erosive damage to the stomach lining where it has herniated through the diaphragm. In severe cases, the herniated stomach portion may become strangulated, cutting off blood supply and causing tissue death and bleeding. These bleeding complications can lead to significant blood loss and anemia if not promptly treated. Patients may experience weakness, fatigue, dizziness, or fainting spells as their blood count drops. Some individuals may not notice gradual blood loss until they develop severe anemia, making it crucial to seek medical evaluation for any signs of digestive tract bleeding. Found this useful? Give it a like, share it with others, and subscribe for more practical health insights.